Welcome back. You're watching NewsX. My name is Vineet Malhotra. Well, India is escalating its war on drugs with a massive nationwide push. Prime Minister Modi has officially launched the Nasha Mukt Bharat Abhiyaan, marking the start of an unprecedented 100-week campaign aimed at eradicating substance abuse across the country. This massive mobilization focuses on sensitizing the youth and cutting off supply chains by targeting international drug syndicates at their source. Before we get into this conversation, let's have a look at India's drug crisis and how it stands today, even in terms of the kind of drugs that are available in the market and how they are used, how many users we have. Of course, India's most used drug on the top of the pyramid is cannabis. So far, what we know is that there are over 3 crore users. It comes in many forms. It depends on how you distill it and filter it. It comes as bhang, ganja, charas, and of course some other forms as well. Opioids has somewhere close to 2.3 crore users, which is a lot. This is of course a more serious drug which combines heroin, brown sugar, opium, codeine. This is the highest addiction that's possible. But heroin, when you start using it, you can't let go. Sedatives have about 1.2 crore users. Prescription pills like benzodiazepines and alprazolam, they're easily available in chemist shops as well. Inhalants, 90 lakh users. Whiteners, glues, thinners, most prevalent among children are some of the users. Synthetic drugs, fast growing category in metropolitan nightlife as well. They come as pills or powders and they have different street names as well as club names and are used exhaustively across the country. Where do drugs come from? From India, well, in the Golden Crescent, which is Afghanistan, Pakistan and Iran, the largest source of opioids. Afghanistan produces the raw opium and heroin. In Pakistan, Iran, Punjab, Haryana and Jammu and Kashmir, that's the route that it takes and gets into our systems. Myanmar, high-grade heroin comes through Manipur, Mizoram and Nagaland. This is of course another triad. In South America, the primary global origin for cocaine is also a center which supplies to perhaps the rest of the world as well. 70% of the total illegal drug volume is smuggled into India through maritime routes such as the Arabian Sea and the Bay of Bengal. And this is obviously a big nuisance. Andaman Sea has had seen some buzz on the in November 2024. The Andaman Sea off the coast of Andaman and Nicobar Islands, it was one of India's biggest drug busts. Approximately 6,000 kg, 6 tons of methamphetamine valued at rupees 36,000 crores was seized. Folks, this is close to about $4 billion worth of drugs that were seized, and they were all headed to various countries including India. We'll talk about this and a lot more with our guest. Joining us on the platform at this point in time is Dr. H.P. Sunania, MD Medicine. We also have with us Dr. Kshitij Agarwal, Medical Officer. Dr. Srijan Garg, Medical Officer again joins us, and Dr. Shaurya Raghav is also with us. Dr. Rakwam Subail is joining us on the program as well. Thank you everyone for being a part of this conversation. Dr. H.P. Sunania, I'll begin with you. I hope you can hear me. I can't hear you. Please turn on your mic. Okay, we'll move on. Dr. Kshitij Agarwal, I hope you can hear me. I'll come to you. Dr. Agarwal?
Yes, sir.
Dr. Agarwal?
Yeah, I can hear you.
Okay, Dr. Agarwal, first of all, in your opinion, how big is this drug menace that the government is trying to eradicate at this point in time? And the volumes that we have discussed across these drugs, they're huge and heavy. How do you think this nuisance can be controlled, considering the fact that most of the targets are our young minds?
I think at a macro level, when you look at it, schemes like, on a broader scale, it is good for all of these bust downs to happen. But I think at a macro, when we talk about the young minds who are consuming it, especially in colleges, schools, unfortunately, they might also be consuming it in the schools. So I think there should be a mediation, and there should not a bus, but there should be some voluntary action taken against those people who illegally sell these drugs to minors or even the young adults. So we have to start at a micro level, because only at starting at a micro level and looking at these, controlling the people who sell these drugs to the young minds at a very in certain districts and all of that. First of all, that has to be taken into consideration.
Okay, fair enough. Dr. Srijan Garg is also with us on the broadcast. Dr. Garg, uh, Pakistan, Afghanistan, these are some of the routes that, in fact, bring in these drugs, and they are pushed all across the country. Afghanistan, we have known, has been one of the biggest producers of heroin as well. And heroin, like we know, is a drug that, you can't let go of easily. And number of times people use syringes and whatnot to use these drugs, and that also has led to other diseases as well, including HIV. In terms of what's happening in India, and even in terms of what we have seen in Punjab, that movie Udta Punjab made it very, very visible that the drug problem in our country is very, very real. How do you rate this nuisance in India today amongst youngsters? You're muted. Dr. Garg, you're muted. Dr. Garg?
In this program.
Okay.
And said that Punjab had a very big problem related to these drugs. Uh, the main problem with all this is the easy accessibility that people have with the drugs, right? It is very readily available. You can just ask a few people, and then you get their numbers, and then you can talk to the dealers and get your drugs, right? So what we need to focus on is not letting the youth get uh, get exposed to these drugs, because at a very young age they start using these drugs, right? And it causes a very bad psychological dependence, and it also affects their physical health. And all these drugs, these are very these are habit forming drugs basically, and they are very bad for the system as well. Like you get dependent, you get addicted to these drugs, and it is a very big problem, because it not only does it help in not only does it increase the chances of having HIV, and these also lead to overdose. Like these drugs can be overdosed on very easily. The this thing is very low. The dosage for them for being gay, so it causes a lot of deaths as well. And for India, because these problems are growing, I think we need to put a stop on it as early as possible, because neither it will lead to something like the US, where fentanyl and all these drugs are so readily available that you have zombie-like states where people they just do drugs and nothing else, and you see the people roaming around the streets on having in a zombie-like state. So that is a very big problem, and it should be tackled at the roots itself. There should be better education services for these drugs, and in schools as well. They should have they should have consultants that they can talk to about these drug users, because most of these drug use things, they start with people having depression. Depressed teenagers, or teenagers in general are very curious about stuff like this. So that's there, and they should be educated about it, and they should be told about what is happening and what is
Okay.
going on.
Okay. All right.
Right? Yeah.
Well, have you ever wondered if taking one drug naturally opens the door to another? Well, that is the fundamental concept behind the term gateway drug. At its core, a gateway drug is a habit forming substance, typically accessible, affordable, or socially tolerated, that may non directly lead an individual toward the use of more potent, illegal, or dangerous substances. The three most common substances traditionally labeled as gateway drugs are alcohol, nicotine, including modern e cigarettes and vapes, and cannabis. So, how does the gateway affect actually work? Scientifically, it operates on two levels, biological and social. Biologically, substances like nicotine and alcohol alter the brain's reward system, specifically spiking dopamine levels. In developing brains, especially in teenagers and young adults, this early chemical exposure can prime the brain's neural pathways, making it more sensitive to the rewarding effects of harder drugs later in life. Socially and behaviorally, using these entry level substances often normalizes drug taking behavior. It exposes individuals to environments, social circles, and illicit supply chains where harder substances like synthetic opioids, cocaine, or amphetamines are readily available and encouraged. However, modern medical research offers an important nuance. Correlation does not always equal causation. Not everyone who drinks alcohol or smokes cannabis will go on to use hard drugs. Addiction experts today increasingly look at the common liability model. This framework suggests that underlying factors such as severe trauma, chronic mental health conditions, genetic predisposition, and social environment are the true drivers that push a person from mild experimentation to severe addiction. In short, while gateway drugs don't automatically trigger addiction on their own, they lower the barrier to entry, making early intervention, education, and awareness critical steps in substance abuse prevention as well. So that obviously lends us a lot of insights into what is the vulnerability associated while taking drugs. Let me bring in Dr. H.P. Sonania once again into this conversation. I hope he can hear me. Dr. Sonania, I hope you can hear me, sir. I guess perhaps not. Okay, let me go across to Dr. Shaurya Raghav, medical officer. Dr. Raghav, thank you for taking out the time and speaking to us. I hope you can hear me.
Can you hear me?
Yeah, I can hear you loud and clear. Well, all right. These entry level drugs, right, are obviously for those people who have done alcohol, have done cigarettes, and are looking to perhaps increase their high or looking to, in fact, for the next dopamine kick. And that's exactly where the intervention has to stop. And like I said in my remarks as well, that not necessarily everybody who drinks and smokes will turn to these drugs, but the probability is that anybody who's on drugs has already tried these two already. So where does the intervention begin according to you?
First, Dr. Srijan Garg said that the awareness is the most important thing. And for example, like first you have to spread awareness. Awareness is the most important thing. And like the one of the most commonly legal drugs which are consumed in India, that is alcohol and nicotine itself. And one of the most illegal drugs that is consumed in India, that is cannabis. So like we are talking about gateway over here. If a person consumes drugs, then uh, like he tries to, like, it is out of curiosity. Like people get in like people get more curious and they want to try new things. So it is very important to spread awareness.
Also rope in Dr. Subayil into this conversation. Dr. Subayil, are you there with us? Dr.
Yes,
Subayil?
I can hear you.
All right. So you've heard the other specialists talk about what's the criteria for interfering at a time when there are telltale signs that somebody is going to get into drug abuse, because that is exactly a critical spot where most parents and perhaps sometimes even medical practitioners cannot observe and intervene.
So I would like to say that there are obvious signs, of course. Now, those signs they can be like who the child or the person is hanging out with. Now, it's also the responsibility of the parents as well. So with whom what's the friend circle of the. Also, unemployment is a major issue, and stress, social media influence, peer pressure, of course, easy availability, and like you said, the it always starts with the gateway drugs. So I would say the things which we should be looking out for, the warning signs should be like decline academic performance, mood changes, secretive behavior, or parents should see, or they should check out for missing money or weight loss, sleep disturbance. So these are some of the warning signs that we should, or anyone in the society should look out for and intervene in time so that it does not progress to higher drugs.
Well, the US drug crisis is a 3-decade public health collapse that evolved from prescription opioid overuse into a lethal synthetic poisoning epidemic. While overdoses cause about 3% of all US deaths overall, they have tragically become the leading cause of death for young adults aged 18 to 44. The US drug crisis is not an overnight tragedy, but a 3-decade public health collapse that evolved in 3 distinct waves. It began in the 1990s when aggressive pharmaceutical marketing convinced doctors to prescribe powerful opioids like OxyContin for routine pain. When regulators finally restricted prescriptions, millions of patients turned dependent. Users were cut off with severe physical addictions, forcing them to look elsewhere for relief. By the 2010s, illicit drug cartels stepped into the gap, flooding American streets with cheap, abundant heroin. Dependent users who had started with legal pills were forced into street drugs just to avoid severe withdrawal, causing overdose rates to climb rapidly. Today, the crisis has reached its deadliest phase with the arrival of illicit synthetic fentanyl. Because it is cheap to produce in lab environments, cartels mix this legal drug with 50 times stronger than heroin into everything from street cocaine to fake prescription pills like Adderall and Xanax. A lethal dose is roughly the size of a few grains of salt, meaning many victims die without ever knowing they took it. While fentanyl is the physical killer, systemic issues drive the crisis. Gaps in the healthcare system leave mental trauma and chronic pain untreated, pushing people to self-medicate. At the same time, economic decay in struggling regions fuels widespread desperation, while societal stigma keeps many from seeking treatment or carrying life-saving tools like naloxone. Ultimately, what began as a pharmaceutical overprescription mistake has mutated into a synthetic poisonous epidemic that requires urgent public health intervention. All right, let me in fact bring in Dr. Garg once again into this. Dr. Garg, the US obviously has had its tryst with drug abuse, and they have not been able to control it. In fact, right from people like Pablo Escobar and the CIA and the FBI working very closely towards various governments, they have not been able to control it. What can India learn from this?
Okay, so basically, what we need to do is we need to make the availability a little less scarce, right? People in India, drugs like ganja and cocaine and something like ecstasy as well and LSD, they're all very readily available. You go to the northeastern states or you go to someplace like Goa. All these drugs are very prevalent there and they're very easily available. So first of all, we need stricter control over the drug, this thing. And we need to, as you said about the stigma as well, there are a lot of people because of unemployment and other causes and other various family issues and depression and stuff like that, that they start consuming drugs. So we need interventions for those things as well. Something like, for adolescents to talk, some places where adolescents can go and talk, or people who are actually like active drug users, they go and talk and they talk about their problems and they get a visual and they get adequate support for that. And for the prescription drugs as well, in a lot of states we get drugs like clonazepam and something and other drugs, antidepressants, without a prescription or even a fake prescription, right? People just can overwrite and get their drugs. So that also is a big problem and that needs to be controlled as well, because the main problem with these drugs is that they're readily available. If you do not have the source, you won't have a problem with the circulation with the circulation, right? So that needs to be done and that needs to be taken care of, I think. And something like bhang and charas, all these things which are readily available everywhere. Something like Banaras, where at every corner you get the lassis and all, right? I
Gutka.
think that needs to be, yeah.
What
Okay,
about
gutka.
gutka and tobacco? Isn't that something which is also equally responsible? For killing hundreds and thousands of people every year?
It is, yes, it is. Tobacco and nicotine basically they cause a lot of cancers. That is why people have these
But it
issues
is
and people
addictive, right?
die.
It is addictive.
Yeah, it is. It is addictive. Yes, it is addictive, and so I feel that just chopping cigarettes and all will not help us. We need to because usually tobacco and these things are not gateway drugs. Something like cannabis or opioids or coke or something like that is a gateway drug, you know, which actually gives you a high. But cigarettes and nicotine, on the other hand, they don't give you a high as such, right? It is just a buzz that gets you there. So we need stricter controls. Like the government had increased the prices for cigarettes and all. That was a good step because उसकी वजह से भी काफी use कम हुआ होगा. People who could not afford it or something like that, है ना? People could not buy it on their own. However, the main problem that we are dealing with today is the drugs which are easily available at any side of the country. You can get weed or ganja, you know, and you can get hash as well. You go to a club and you go to a party, you'll see people doing MDMA there, ecstasy, LSD, and everything. All of that is very readily available, and we need to figure out a way to stop the sources and to get these people help, because one of the major factors that these people can't stop using these drugs is because they don't have the adequate support, or the support infrastructure is not there for them, right? So it creates a very big problem as such.
Okay, all right. Let me also bring in Dr. Agarwal into this conversation once again. Dr. Agarwal, are you there with us?
Yeah, sure.
Dr. Agarwal, what about gutka and pan masala and some of these other, addictives which definitely are also contributing to people, losing their health, losing their life, losing their productivity?
So when you talk about gutka, I think a bigger problem with substances like gutka, pan masala is that not only they stimulate your brain to a point where you could get a high and all of that, but I think more important concern with uh, drugs that you put close to your tongue, sublingually, and all of that is they also cause cancer, right? Over time, and it is proven. And I think the government or the board, the regulatory board, are already doing a decent job in spreading awareness. There is a clear-cut, distinct warning on the cigarette packets, right in front, right at the you know uh, front of the packet, cigarette packet, that smoking kills. And even before the movies are played or in the intermission, they say that smoking can kill you, and even gutka, pan masala can kill you. I think another thing that needs to be done, which is I think you know, making it so casually advertised, like pan masalas and all of that. And I know that pan masalas and gutkas, the raw gutka that people get it, illegally, which are not packaged officially. There's there's a difference in safety profile, obviously. However, still, I think there should be some more regulatory um, uh, rules when it comes to advertising pan masala so much. That is my opinion.
Well, we've assimilated a lot of good advice over here, and I hope that the Prime Minister's push when it comes to this drug ecosystem and the powers that are trying to, in fact, push it into India is going to be destroyed systemically. I appreciate everybody who joined in and spoke with us. It's time for a short break. We'll be right back.
बच्चों को ये तो